Here are 10 Puerto Rico Medical Board style clinical vignettes focused on hematopoiesis and blood disorders, anemias, each with 4 answer choices and detailed explanations. Vignette 1, Iron Deficiency Anemia. A 45-year-old woman presents with fatigue, pallor, and brittle nails. Labs show low hemoglobin, low MCV, low ferritin, and high TIBC. What is the most likely cause of her anemia? A. Thalassemia. B. Iron deficiency anemia. C. Sideroblastic anemia. D. Anemia of chronic disease. Answer B. Iron deficiency anemia. Explanation: iron deficiency anemia presents with microcytic hypochromic RBCs, low ferritin, iron storage, and increased TIBC. It is often caused by chronic blood loss, e.g. menorrhagia or GI bleeding. Vignette 2. Thalassemia. A 30-year-old Mediterranean man presents with mild anemia. Labs show low MCV, normal iron studies, and a target cell smear. What is the best next step? A. Bone marrow biopsy. B. Hemoglobin electrophoresis. C. Iron supplementation. D. Reticulocyte count. Answer B. Hemoglobin electrophoresis. Explanation: thalassemia presents with microcytic anemia with normal iron levels. Hemoglobin electrophoresis can confirm beta thalassemia, increased HbA2 and HbF. Vignette 3. Anemia of chronic disease. A 65-year-old man with rheumatoid arthritis has anemia. Labs show low iron, low TIBC, and high ferritin. What is the likely cause? A. Iron deficiency anemia. B. Sideroblastic anemia. C. Anemia of chronic disease. D. Vitamin B12 deficiency. Answer C. Anemia of chronic disease. Explanation: chronic inflammation causes hepcidin release, which traps iron in macrophages. This results in low iron and low TIBC but high ferritin. Vignette 4. Vitamin B12 deficiency. A 60-year-old man with a history of gastrectomy presents with paresthesias, ataxia, and glossitis. Lab results show MCV 100, hypersegmented neutrophils, and low serum B12. What is the likely cause? A. Iron deficiency. B. Vitamin B12 deficiency. C. Folic acid deficiency. D. Anemia of chronic disease. Answer: vitamin B12 deficiency. Explanation: B12 deficiency causes megaloblastic anemia and neurologic symptoms. It is common in pernicious anemia, gastrectomy, and Crohn's disease. Vignette 5. Folic acid deficiency. A 25-year-old pregnant woman presents with fatigue. Labs show MCV 100, normal methylmalonic acid, and low folate levels. What is the likely diagnosis? A. Iron deficiency anemia. B. Vitamin B12 deficiency. C. Folic acid deficiency. D. Hemolytic anemia. Answer: C. Folic acid deficiency. Explanation: folate deficiency presents with megaloblastic anemia, but no neurologic symptoms. Methylmalonic acid is normal, distinguishing it from B12 deficiency. Vignette 6. Hemolytic anemia. A 19-year-old African-American man with sickle cell disease presents with jaundice and back pain. Labs show low hemoglobin, high reticulocyte count, and elevated indirect bilirubin. What is the likely diagnosis? A. Iron deficiency anemia. B. Hemolytic anemia. C. Aplastic anemia. D. Vitamin B12 deficiency. Answer B. Hemolytic anemia. Explanation: hemolysis leads to increased indirect bilirubin from RBC breakdown and high reticulocyte count, bone marrow response. Vignette 7. Hereditary spherocytosis. A 12-year-old boy has a family history of anemia and splenectomy. His smear shows spherocytes, and his osmotic fragility test is positive. What is the underlying defect? A. Spectrin or ankyrin mutation. B. Beta-globin gene mutation. C. G6PD enzyme deficiency. Defective transferrin receptor. Answer: A. Spectrin or ankyrin mutation. Explanation: hereditary spherocytosis is due to membrane protein defects, spectrin ankyrin, leading to spherocytes and hemolysis. G6PD deficiency. A 30-year-old man takes sulfa drugs and develops jaundice. A blood smear shows Bite cells and Heinz bodies. What is the most likely diagnosis? A. Sickle cell disease. B. Thalassemia. C. 6PD deficiency. D. Aplastic anemia. Answer: C. G6PD deficiency. Explanation: G6PD deficiency causes hemolysis in response to oxidant stress, drugs, infections, fava beans. Heinz bodies and Bite cells are classic findings. Vignette 9. Aplastic anemia. A 35-year-old woman presents with fatigue, recurrent infections, and bleeding. Labs show pancytopenia with a hypocellular bone marrow. What is the most likely cause? A. Hemolytic anemia. B. Vitamin B12 deficiency. C. Aplastic anemia. D. Polycythemia vera. Answer C. Explanation: aplastic anemia is due to bone marrow failure and causes pancytopenia, low RBCs, WBCs, and platelets. Vignette 10. Cold agglutinin disease. A 68-year-old woman presents with Raynaud's phenomenon and hemolysis. A Coombs test is positive for IgM. What is the likely cause? A. Warm autoimmune hemolytic anemia. B. Cold agglutinin disease. C. G6PD deficiency. D. Hereditary spherocytosis. Answer B. Cold agglutinin disease. Explanation: cold agglutinin disease is associated with IgM-mediated hemolysis, triggered by cold exposure and often linked to Mycoplasma pneumoniae or EBV.